You are dispatched to a local high school for a person having difficulty breathing. The scene is safe.
Okay, my BSIs are on. Hi, my name is Shar. What seems to be the problem today? Chest pain? Okay. What were you doing when the chest pain had started? You were playing basketball? Okay, how long ago did this happen?
Like 30 minutes.
30 minutes ago? Okay. Is there anything that you're taking right now? Like any albuterol, any medication?
And
Adderall? Okay. How often do you take your albuterol?
during whenever
After I eat? Have you had trouble breathing lately with your activities?
yes.
Okay. What is your pain scale right now?
4 or 5.
4 to 5? Okay, is there any pain when you move at all? A little? Okay. So what I'm going to do is I'm going to go and I'm going to listen to your lung sounds just to check if we have any wheezing or anything, okay? So if you can sit up for me for a bit. Okay, breathe. Take a deep breath. Okay, so what I'm doing is I'm going to be listening for wheezing, lung sounds, making sure she has no wheezing. Do I have wheezing in the chest or any sounds in the chest?
Bilateral expiratory wheezes.
Okay, and what is her respiratory?
Respiratory is 28.
Okay, so so what I'm gonna do is I'm gonna put you on a high flow oxygen and then in the meantime I'm gonna just do an assessment and ask some more questions. Okay, so say we're putting you on oxygen, high flow, 15 liters per minute. Okay, so what I'm gonna do now for my patient is I'm gonna do a patient assessment, a head to toe assessment. So what I'm gonna do is I'm gonna check her head, her ears, her neck. Am I finding any bleeding, any broken bones?
No.
Okay, CVM's in check. Go up, go down,
Yes.
and then her capillary. Okay, that one's good. Okay. What were you? How long has the pain been there again? 30 minutes. Okay, so 30 minutes. Last oral intake was 30 minutes as well, right? And you were playing basketball when this had happened, right? Okay. So I'm gonna put this patient as a priority transport, and I'm gonna call ALS. While they're on their way, I'm gonna assist my patient with her prescribed albuterol. Do you have your albuterol with you? Okay. So what we're gonna do is we're gonna take off the oxygen and then I'm gonna assist you with the albuterol. Okay. So if you can take it out, I don't know where you have it at. Okay. Okay. So we're gonna take off your oxygen and we're gonna assist you. So shake your albuterol 3 times. Okay. So what we're gonna do before we administer it, we're gonna take a deep breath in, out. Okay. Now 1 puff. Breathe in. 1, 2, 3. Out. Okay. So before we take the second puff, we're gonna do it again. Breathe in and out, and then we're gonna take the second puff. Okay. Okay. And then the second puff. Breathe in, and then hold for 3 seconds, and then slowly let it out. Okay. So what I'm gonna do is I am going to put her back on oxygen, and I'm gonna leave it on 15. So I'm gonna, like I said, I'm gonna monitor her for every 5 minutes because she is a priority transport. Say it's been 5 minutes so I'm gonna do another set of vitals. So we're gonna listen to her chest again, or her lungs again. Breathe in and breathe out. Is her breathing, or has her respiratory got any better?
Respiratory is at 20.
Okay, so it went from a 28 to a 20. So what we're gonna do, so with her respiratory from 28 to 20. It is labored breathing, so I don't want her to tire herself out even more. So what we're going to do is we're going to assist her with the BBM and assist her with her breathing. So my partner and I are going to put you on a stretcher and we're going to assist you with your breathing with high flow oxygen. So what we're going to do is we're just going to put like an oxygen mask over, and we're just going to do with the bag just to make sure your oxygen gets a little bit of oxygen as well. Okay. So with that said, what is her blood pressure again?
Blood pressure now is at 140 over 88.
140 over 88. Okay. So we're gonna monitor her blood pressure. We're gonna monitor her respiratory. So ALS has ALS arrived on the scene?
Yes.
Okay. So ALS had arrived on the scene. So what I'm gonna tell the ALS is I'm gonna tell them that they 17-year-old black male, chief complaint of trouble breathing. Onset was playing basketball. Patient is allergic to peanuts. Respiratory rate when I arrived was at 28. She has wheezing. He has wheezing in his chest. I did a head to toe body assessment, and everything is in with normal limits. She's having tightness in her chest. She said it hurts when she does move. I did assist her with her albuterol that was prescribed to her, so I gave her 2 puffs as prescribed, and I have her on high flow oxygen. 15 liters. I checked her just before you guys arrived, her vitals again. I was checking them every 5 minutes, and her respiratory went down from a 28 to a 20. Her blood pressure is 140 over 88. So what my partner and I have done is we have assisted her with the BBM and have her on a stretcher in the ambulance ready to transport. Okay? Yes.